How's it going, guys? It is a gloomy, rainy day today here in Southern California, but the show must go on. So the topic of today is physical therapy the right career choice for you? So let's get to it. So first off, what is physical therapy and what does being a physical therapist entails, right? So as a physical therapist, whether you are a DPT or a PTA, you are the person in charge of injury rehab, surgery, recovery, or treating any disease that affect the patient physically. So like any heart conditions, stroke, cerebral palsy, anything like that. You are in charge of recovery and rehab. Now, a common question that we get is, what's the difference between being a physical therapist and an occupational therapist? To keep it short and simple, being a physical therapist, you are adapting your patient to the environment around them. As an occupational therapist, you are adapting the environment to the patient. That's the simple way of thinking about it. So if you're deciding if you want to be a physical therapist, one of the first thing I'd say you need is you got to be a people person. And I know everywhere you look, the first thing people say is you got to have the passion for it. You got to have the drive to work in healthcare. For me, I don't put that as number one because, well, that's a given, right? You got to have the drive, you got to have the passion to be in any career, or else you're going to hate your job. So put that aside. You got to be a people person, right? Now, why I say that, it's because as a physical therapist, you got to be able to communicate with people. You got to be able to educate people, and you got to do it effectively. You got to do it in a way where they are able to understand why you're doing what you're doing and why they need to do what they need to do outside of the clinic, out of the hospital, or whatever it is, to be able to stay healthy, to be able to stay functional. Now, as for the perks of being a physical therapist, you have quite a bit. So as a physical therapist, you are in a flexible field of work. And what I mean by that is not like you get to pick and choose when you want to work, but it's more so you get to choose what you want to specialize in. So you can either do sports physical therapy, where you work with athletes, sports team, anything like that, or you can work in a hospital working with pediatrics, geriatrics, surgery patients, anything like that. Or you can work outpatient, and again you can work in a sports clinic, an outpatient clinic, you can work home health. So you have a lot of options as to what kind of scene and environment you want to be in. Another perk of being a physical therapist, you do get decent pay, depending on the environment you're in, right? You can be a PTA, making as low as maybe $50,000, $60,000, all the way up to a DPT who could make six figures. So you get a wide range of pay when you get into the physical therapy field. Another perk I'd say is schooling. The schooling for physical therapy is, I'd say, on the quicker end, depending on which way you go. If you go PTA, you can finish as fast as 18 months and you can be out there working. Granted, you got to pass the board exam first, but you can finish within a year, a little over a year. For a DPT, the minimum is 7 years because you do need a bachelor's degree. But it could be a little bit quicker if you can get your bachelor a little bit quicker as well. So, it depends. Now, I did make a video talking about the differences between a DPT and a PTA. I'll link it above. Just go ahead and go ahead and watch that video after this one, all right? Now, of course, every good thing comes with bad, right? There's always challenges with every field of work, and it can't always be rainbow and sunshines. So the first challenge of being a physical therapist is you are going to spend a lot of time on your feet. So it could be 7-8 hour days. if you work in a hospital, it could be longer depending, on your shifts. So you definitely want to be prepared for that. Get some, insoles, get some comfortable shoes that you can be in for pretty much all day long. Another challenge is it could be an emotional toll if you're an emotional person, because you are going to be seeing a lot of patients and they're going to be, talking about their pain, talking about their feelings. Some patients, when they're in so much pain or they're fresh out of surgery and they can't move, they can't do their daily things, it can put them in a depressive, state of mind. So you are the person that's kind of like their emotional crutch at times, as well as they're there to treat them physically. So you got to be prepared for that as well. Now, this perk is mostly for DPT. You have to deal with insurances. Now, insurances, some of them can get super picky, some of them are a little bit more lenient, but majority of the time, you gotta document how the insurance wants you to document to make sure you get paid for what you did, right? One thing to know about this field is it's an evolving field. It is gaining in popularity as a career, but also as a way of treatment. So as a physical therapist, you should always be looking to learn, whether that's from other people, other physical therapists, or through your own research. There are seminars out there that teaches you different things about physical therapists, being a physical therapist and all as well. There's always different treatments out there, and there's always new, inventions, new technology that helps us with treating patients. So it is a growing field of work. One thing to note about being a DPT and a PTA is when you're going through schooling, surround yourself with other students, because they are going to be your circle of help, circle of support, because no one knows what you're going through more than other students. You guys are all going through the same thing, so you guys are there to support each other. You guys are there to learn from each other, and as well as talk to your professors, because most of the time they are more than likely already either a PTA or a DPT, and they transitioned into teaching. So you can always seek their knowledge. So yeah, that's pretty much almost surface level of what it takes to be a physical therapist. But hopefully this kind of helps you get your mind started, kind of get into the thinking of, is this career field the right one for me? But other than that, go ahead and subscribe for future content just like this one, and I'll talk to you later. Peace.